Hello! In this portion of the presentation, I'm going to be talking to you about the third of the three core characteristics of autism. The third characteristic is repetitive, restricted, and stereotyped behaviors. Before we jump into the more specific definitions, the DSM criteria and all of that, I want to focus in on something that I think is a little confusing for a lot of people who are new to this field, and that's the difference between the words stereotype and stereotypy. So I'm going to refer you to the slide here because I have the two definitions laid out for you, so you can follow along. Stereotype is the word that we hear most often in everyday language, and that is a widely held but fixed and oversimplified image or idea of a particular type or person or thing. So that's, you hear about racial stereotypes and sexual stereotypes in terms of things that women do, things that men do, things that little kids do, etc. And then the more specific definition that I think we should really focus in on is stereotypy, which is the persistent repetition of an act for no obvious purpose. And that's really what we're dealing with people with autism, is this persistent repetition of an act, especially for no obvious purpose. So I have a little fun sentence there for you, which is the stereotype of the stereotypy of a person with autism is often rocking or hand flapping. So these are stereotypes of the stereotypies associated with autism. So now we can move on to the more specific criteria listed in the DSM-4. So restricted, repetitive, and stereotyped patterns of behavior is listed as the third criteria in the DSM-4. And so anyone who has autism is going to have at least one of the following four things in order to be diagnosed with ASD. So these four items that they could have is A, stereotyped and restricted patterns of interest, which are abnormal in focus or intensity. B, inflexible adherence to specific or non-functional routines. C, stereotyped repetitive movements. Or D, occupation with parts of objects. So these are fairly straightforward in terms of just being laid out in plain words what they are, but to give you a little taste of what these could look like in the real world, I have on the next slide some example behaviors of these, what stereotyped behaviors look like in the real world. So we have self-injury, obsessions, insistence on sameness, and formulaic questions and phrases. So formulaic questions and phrases I think is one to really focus in on, because a lot of people don't realize that this characteristic can affect language in the way that it does, in that these people with ASD often use the same phrases and words on a really repetitive basis. Even within the same conversation, they might ask the same question more than once. So, for example, if one of their obsessions is movies, in a conversation with a person they just met, they might ask, "What's your favorite movie?" to start the ball rolling, and then after they've talked with them for 3 minutes and the conversation starts to move to another topic, they might say, "What's your favorite movie?" and bring it back to A, their obsession, and B, a formulaic question that they already have in mind that they can grab really quickly. So we can see that these stereotype behaviors really do link together in terms of the obsessions and the formulaic questions and insistence on sameness, even really bringing it together. And these are, of course, just a few examples of any multitude of possibilities. So even within the category of self-injury, hand biting and head banging are two examples, but there's any number of behaviors that might manifest. So I hope that this was a good introduction to this category, and I hope that you enjoy the rest of the presentation. Thank you.